Hello everyone. In this session, we are going to discuss an important topic that is endometrial carcinoma, also known as uterine carcinoma. Usually, you get a long question on it. So, on carcinomas, you have to write everything. Not only on this carcinoma, if any carcinoma, any malignancy asked as a long question in your university exam, you have to write everything about it, starting with its classification, etiology, predisposing factors, gross, microscopy, clinical features, and spread. So, we will discuss all these things for endometrial carcinoma also. So, let's start the topic. Endometrial carcinoma. So here you can see we are starting the topic that is endometrial carcinoma. First, I will let you know the introduction. What is endometrial carcinoma? Then I will let you know the most common age of presentation. Then its classification. Then the risk factors, predisposing factors, etiology, whatever you say. Then we will see the pathogenesis, gross, microscopy, clinical features, and finally the spread of this cancer. So if this coming as a long question, you have to frame your answer under these headings only, learn these headings and understand, write your own language under each of them. So let's start with the introduction. Before that, you must understand there are three layers in the uterus, in the uterine cavity. So there are three layers. The uterus wall is made up of three layers. The innermost layer is the endometrium. You can understand here the innermost layer is the endometrium. You can see this is the endometrium. The middle layer, this is endometrium, the innermost layer. The middle layer is myometrium. Can you see this one? The middle layer, which is very thick, that is myometrium. And outermost layer, that is perimetrium. The perimetrium is the serosa. Currently, I am teaching you endometrial carcinoma. So, endometrial carcinoma arises from the endometrium. It's a tumor of endometrium, not myometrium. The tumor of myometrium is leiomyoma and leiomyosarcoma. There is a separate video on that. But currently, I am teaching you endometrial carcinoma. So, let's start the topic endometrial carcinoma. What is the introduction? In the introduction, you have to write it is the most common pelvic invasive cancer of female genital tract. From the female genital tract, the most common pelvic cancer, pelvic malignant cancer is endometrial carcinoma only. You can see it is occurring in the uterus, in the endometrial cavity, in the endometrium. Most common age of presentation is post-menopausal. So, you know, in females, the menopause occurs from 45 to 55 years of age. So, it occurs after that. So, after that, it occurs usually in 6 to 7 decades. 60 to 70 years is the most common age of presentation. It occurs in old females. That is endometrial carcinoma. Now, classification. Coming on the classification, it is of two types, type 1 and type 2. The etiology of both types is different. The risk factors for both the types is different. Type 1, the most common risk factor is unopposed estrogen axis. Whenever there is estrogen axis in female body due to endogenous or exogenous source, it increases the chances of endometrial carcinoma. So estrogen axis is the risk factor. Type 1 occurs in obese female, but type 2 occurs in thin female. So type 1 occurs in obese female, type 1 endometrial carcinoma, type 2 occurs in thin female. So you can understand the two types, the risk factors are totally different. Type 1 occurs in diabetes mellitus, hypertension, nulliparous state, and hereditary. So these are the risk factors of type 1. Type 2 have only two risk factors. Number 1, thin physique, and number 2, atrophied endometrium. If the endometrium is atrophied. So that is a two risk factor for type 2. So learn the risk factors separately for type 1 and type 2. Learn endometrial carcinomas of two types, type 1, type 2. Learn the two risk factors separately. This occurs in obese, this occurs in thin. Here, one more risk factor is endometrial atrophy. Here, apart from obesity, the other risk factors are estrogen axis, there is hypertension, diabetes. So these are the risk factors. So learn the risk factors like this. Now, coming on the pathogenesis. In the pathogenesis, you have to learn the genes which get mutated and leading to type 1 or type 2 type of endometrial carcinoma. So genes are different. In type 1, the most important gene which get mutated is PTEN. In type 2, the most important gene which get mutated is BRCA1, BRCA2. Apart from that, other genes are also there. In type 1, others are PIK3CA gene, but PIK3CA gene is in both, in type 1 as well as type 2. Apart from that, PIK3R1, KRAS, and P53 is there. Here also P53 is there, and apart from that, some other genes are also there. So learn the main gene. Here main gene is PTEN, here main gene is BRCA1, BRCA2. So that is the germline mutation you can learn in case of hereditary type 1 and type 2. Now coming on the gross. In the gross, two type of patterns are there. Either the tumor is polypoidal in the form of a polyp. Can you see the tumor is in the form of a polyp? Or it can be a diffuse tumor filling the cavity completely. It can be a diffuse tumor filling the cavity completely. Now coming on the microscopy, there are three different patterns of the microscopy. In the gross, we have two patterns, polypoidal or diffuse. In the microscopy, we are having three patterns, well differentiated, moderately differentiated, and poorly differentiated. In well differentiated, the tumor is arranged in glandular pattern. You can see the glands. The tumor is arranged in glandular pattern. The glands are there which are back to back arranged. There is no stroma. In the background, hardly any stroma.